Easley, South Carolina. And I want to thank you all for joining us this evening, whether you are a member of One Church or a friend of One Church. We are so glad that you took some time this evening to sit with us and learn more about the COVID vaccine. And our hope is that by the end of our discussion tonight, you will have the necessary information that you need to make an informed decision about the vaccine and ways to protect you and your loved ones from COVID-19. So that we can be sure that everyone on the call can hear all the information being discussed, and so that everyone has an opportunity to have their questions answered, especially given the number of people we have on the call right now, and considering that more people might be joining us. If you could mute yourselves for now, and then if you do have a question though, please put it in the chat. I'll be monitoring the chat throughout to be sure that we get your questions answered. If not during the discussion, then definitely at the end. If you happen to be joining us via phone, I'm not sure if we have anyone yet via phone, but if we do, we do, we sure do. If you're joining us by phone, we definitely still want to get your questions in. And so we'll make sure that we save time towards the end of the chat for you to come off mute if you still have questions at the end of the discussion. So as you all are painfully aware, we have been in the midst of this pandemic since March of 2020. So we're almost at a year of being in this. And you know, it hit us and it hit us hard. Nationally, within the US, we've seen over 28 million people contract the virus, and over 500,000 people, unfortunately, have died as a result of the effects of the virus. In South Carolina, here in our state, we've been somewhat in the middle of the pack numbers-wise, with just over 500,000 total COVID cases within this past year and over 8,000 deaths, which is still way too many. Now, since about mid to late January of this year, we have been seeing the numbers of new cases of COVID-19 kind of consistently trending in a more favorable downward direction. But of course, we are not in the clear, nowhere near being in the clear yet. Now, while the number of new cases nationally is on the decline, the most recent data from the CDC does show us that we are seeing a slight uptick in COVID-related deaths in this past month. Now, again, here in South Carolina, we are seeing a trend of declining new COVID cases and also declining COVID-related deaths. Although just this past week and a half, we did see some data that showed a slight increase in deaths reported. And so what you want to keep in mind is that even with these new favorable data trends, people are still getting sick, people are still getting severely ill, and people are still dying. So the goal is still to minimize your risk of getting COVID as much as possible. Now, if we look a little further at the data here in South Carolina, where One Church is, we do see some differences in COVID numbers between racial groups. And in fact, we see those differences if we look at the national data as well. For South Carolina, we know that Blacks make up about 26% of the population in South Carolina, and similarly make up about 26% of those who have contracted COVID. However, unfortunately, in South Carolina, Blacks make up about 32% of those who are dying of COVID. But then when you look at the other end of the spectrum at people who are getting vaccinated, only 14% of those who've gotten vaccinated in South Carolina are Black. Now, you would hope that that number, that percentage would be a little bit higher, kind of mirroring our representation within the state population. But of course, as the vaccine becomes more readily available, we definitely hope to see that number increase as a larger percentage of people younger than 65 will become eligible to get vaccinated. Now, nationally, due to a limited supply of the vaccine, most states are distributing the vaccine to people in a step-by-step basis, with the most vulnerable among us being given the priority. Now, in South Carolina, we are currently in what we're calling phase 1A, which includes healthcare workers, anyone ages 65 and over, regardless of whether you have an underlying medical condition, residents and staff of long-term care facilities, and parents and caregivers of children who are medically fragile. Now, as of right now, and this could change based on vaccine availability, phase 1B, the next phase, is slated to begin in early spring, and that would include more frontline essential workers such as teachers, law enforcement, daycare workers, grocery store workers, and then the phases after that will continue, and by summer and into the fall, according to the Department of Health, it is hoped that anyone who wants to receive the vaccine can start getting that towards the summer and into the fall. Now, of note, the vaccine is currently not approved for use in children. So knowing that COVID-19 is still a very real threat, especially in our community, And also knowing that we're trying and making positive strides to get as many people vaccinated as quickly as we can, as a health and wellness ministry, we wanted to take this opportunity this evening to discuss the vaccine and answer your vaccine questions so that when you and your loved ones are eligible to receive it, whether that's now or in the near future, you can make an informed decision about that. So to help us with this evening, we have one of One Church's very own members, Dr. Jeremy Davis, leading our discussion tonight and sharing with us what's important for us to know about the vaccine. Dr. Davis is a board-certified internal medicine physician, and he is currently on staff at Prisma Health as a hospitalist physician and as an assistant clinical professor with the USC School of Medicine in Greenville. We are also very excited to welcome Dr. Tyson Bell to the discussion this evening. Dr. Bell is an assistant professor of medicine in the divisions of infectious diseases and international health and pulmonary and critical care medicine at the University of Virginia. He is also the director of the Medical Intensive Care Unit and the director of the University of Virginia Summer Medical Leadership Program. Dr. Bell, thank you so much for joining us tonight. And at this time, Dr. Davis, I am going to turn it over to you.
Thanks so much, Dana. What a great introduction. I do want to call out Dr. Bell. I really appreciate you participating on this call. Dr. Bell and I, we've known each other for a long time, even prior to having that doctor before our names. And so it was just Tyson and Jeremy when we first met and interacted. So I'm glad to have Tyson, Dr. Bell, here on this call. There's no one better to be able to explain some of this or to answer some of our questions than Dr. Bell, who is both critical care, so he sees and takes care of patients who come into the hospital with COVID or has seen throughout this pandemic and these very, very sick patients who are admitted to the ICU. But he also knows the science, and he also knows the workings behind infectious disease because he's also board certified in infectious disease. And so there's no one better qualified to talk to us today than Dr. Bell. So I really do appreciate that he's able to make this call with us. Now, I'm glad that we're able to have this discussion. This is something that's very much needed in our community, very much needed within our country, globally also, but definitely within our community. And Dana, as you've pointed out, COVID has overturned, it's ravaged, it's caused irreparable damage to people's lives, the American way of life, to the global stage and to the local stage. And it's also caused a lot of damage within our community and especially within the Black and Brown community. And so with this discussion, we're not looking to strong arm you into getting a vaccine. I'm not looking to try to convince you to get a vaccine, but I do want to present as much information as we can so that you can make an informed and educated decision on whether or not the vaccine is for you. There's so many outlets right now besides internet. You have TV news outlets. You got Bruh Man on the corner telling you what he thinks about the COVID vaccine. And so there's a lot of information that's being presented. We just want to make sure that you have accurate information to decide whether or not the vaccine is for you. In that same light, we want to make sure that throughout this discussion, the information that we present, you still should follow the advice and the recommendations from your primary care doctor. So, however, make sure that you have discussions, but hopefully you're better armed with information to have these discussions with your primary care doctor if there are questions, if there are concerns about your own medical history. And so I do want to make sure that we point that out. Now, that being said, let's get into it. And so with this discussion, I want to make sure when we talk about vaccines, we need to make sure that we talk about why vaccines. So there's never a time where I just want to blindly give you information. And so why do we do vaccines? So throughout history, we know that we've seen numerous people die, get sick from disease. We've seen numerous people with comorbidities or people with a lot of lasting disease or illness because of some viruses, bacterial infections. And so a vaccine was a brilliant idea that someone said, well, how do I protect myself without actually having to go through the disease process? So without getting the disease, how else can I protect myself? And insert vaccines. So vaccines it works by stimulating your immune system so that it works together to control to kill and for your body to remember certain diseases so that if you ever present it again, you have the ability to fight that disease. So remarkably, vaccines have been around for a long time. Just in my career, I have never seen a case of polio, and I've never seen a case of smallpox. And the reasons I've never seen any of those cases is because polio was eradicated from the US around 1979, and smallpox was eradicated about 1952. And they were eradicated because of the use of vaccines. And so vaccines are going to continue to be important, and it's definitely important now within the pandemic of COVID-19. And what's worrisome is with COVID-19, we've seen the virus spread from person to person. We've seen the severity of illness that some patients or people can have once they contract the disease. And so left unchecked, the amount of death that we've seen or illness that we've seen because of COVID-19 would not stop if we don't do something different. And so one of the first starts is the CDC recommendation of making sure that you're masking, making sure that you're hand washing, making sure that you're social distancing. But using the vaccine is going to help provide more of a protection for us, but also help us potentially try to end this pandemic. And so that's where the vaccines and why vaccines are so important, especially now within COVID-19.
Dr. Davis, I have a question, kind of a follow-up or a piggyback off of that. You mentioned polio and smallpox, and these are vaccines that, like you mentioned, have been around for a while. And so people naturally may feel more comfortable getting those vaccines because we have so much information about them and how they work. Can you give us more information about the COVID vaccine specifically and how that works against the virus, knowing that it's still so new and people may have questions about that particular vaccine and how that works?
Okay. All right. No, great question. So I think in order to really talk about the COVID vaccine, we do want some basic, very, very basic knowledge about how our immune system works, because the vaccine is what is going to promote our immune system in working. And so I'm not going to give you a long lecture on biology. I just want to make sure that you understand the basics. And the basics of this is the object of your immune system is to recognize something that doesn't belong. So doesn't belong in your body. And so you want to be able to mount a response to that thing that presents to your body that's not yours. And then you also want to kill, destroy it, produce antibodies against it to help destroy it. And then ultimately you want your immune system to remember how to fight it in the future. And so that's the basics of an immune response. Now, the COVID vaccine itself is right now, there's 2 approved. And I don't know if I haven't seen any of the data, whether or not Johnson & Johnson got approved today yet.
Yes.
It did get approved.
They got approved today. Yes. Mm-hmm.
So Johnson & Johnson is approved. So now there's currently 3 vaccines that are currently available. Talking about the first 2, because they're a different class in that the first 2 vaccines are from Moderna and Pfizer. And this works by inserting what we call mRNA into the body so that it allows the immune to produce a response to the vaccine or to that mRNA. The mRNA uses your body's own machinery. So it's like having a recipe. The mRNA is having a recipe, it's directions. You insert that into your body, it goes into the cell. And in your cell, you already have the workings. You already have the kitchen. You already have the utensils and the tools that you need. And it produces a protein that is the protein that's very similar to the protein that you see on COVID or COVID-19, the virus. And now your immune system sees that protein and it attacks or develops antibodies, and then it develops that memory against that protein that we call it a spike protein. Within coronavirus, and it develops that immunity to, or that protection to that protein. And that's where how that vaccine works.
So I heard you mention the term mRNA, and I just want to ask this question because I've heard this myth before that people think that getting a vaccine will alter their DNA. Can you help dispel that myth for us?
Okay. Yeah. Tyson, you want to take this one?
Yeah, I'll jump in on this one. So
Thanks.
so thanks for all having me. I love talking to church communities because I was raised in the church. It's my lifeblood. That's a really good question because it is genetic material, and you want to make sure that if you're putting something in your body, it's not going to change who you are. So let's talk about how this is actually going to work. So if you can imagine your cell is like a bank, and when you walk into a bank, what you see at first are the tellers, the people doing business. The business of the bank is kind of what you see first off. There's also the safe in the vault where the real business of the bank happens, and no one can go back there unless you're supposed to be back there, right? Now, the way the messenger RNA works, it really deals with just the business side of the cell. So it goes right into that part where the action is, but it does not go into that temple where the DNA is. It doesn't even function. It can't gain entry into that part of where your own genetic material is. So it actually just goes, gives that recipe, goes into the kitchen, lets you make that spike protein, and then it actually dissolves within just a few hours of being injected into your body. So it's like a delivery man. It comes, delivers the package, and then it goes. Now, what it does teach you to do is make that spike protein, like Dr. Davis said, and then you get an antibody response to it. But it stays out of that sacred temple that is your DNA. It stays out of that vault. So it does not integrate with your DNA. It also does not give you COVID-19 because the spike protein by itself doesn't cause any damage. And when it's attached to the coronavirus, that's how it gains entry. But when it's made by itself, it doesn't cause any harm at all. But your body allows it to present it, show your whole immune system that this is the spike protein. It's not supposed to be here. Your body makes a response to it, makes antibodies. And then if the real coronavirus comes back around, your body gets a jump on it. You can start busting it up right away. And that's how you can avoid getting sick, how you can avoid going to the hospital.
Thank you for that. That bank analogy makes total sense. And Dr. Bell, I was wondering, now that we know that the Johnson & Johnson vaccine has been officially approved, could you speak more to the Moderna versus the Pfizer versus now the Johnson & Johnson vaccine, how they're similar, how they're different, and how they work, how they work against the COVID-19 virus?
Right, good question. So as Dr. Davis said, the Moderna and the Pfizer vaccines are all based on messenger RNA or mRNA technology, and we described how that worked. The Johnson & Johnson is a little bit different. So it's like a different vehicle, but you're going to the same destination. So instead of messenger RNA, what it uses is a virus that normally causes the common cold called the adenovirus, and that name's not important, but it's the adenovirus that causes infection. It does not have the ability to cause you to get sick. It can't even replicate itself, so it can't kind of multiply. It just delivers the package and then it goes away. And then it uses DNA, which is a little different than messenger RNA, but it works the same way ultimately in that it teaches your body to make a spike protein that's very similar to the coronavirus. And then you make that spike protein, your immune system sees it, makes antibodies, makes a memory, and then at the end, if you get infected with COVID-19 or the coronavirus, same thing happens. Your body is used to it. It's seen it before. It has the response. It can bust it up and get it out of the way. So it's just a little bit of a different way of getting to the same destination. Now, what makes that different is that the adenovirus vector, or the way it's using it, is more stable than the messenger RNA or Pfizer or Moderna. So you may have heard that the Johnson & Johnson is a little bit easier to store. You actually don't have to freeze it, and that's because it's a little more stable than the other two vaccines. It's also one dose, and we probably know that as well by now too, because instead of getting two like the Pfizer Moderna, this is a one dose regimen. They are studying what happens if you do get a second dose, but right now it's authorized for the one dose, which is great because, I, for one, I'm a doctor. I put a lot of needles in people. I don't like getting needles myself. Since I was a kid, I just hated them. So by the time there were vaccines available for me, I sucked it up, but I really wanted to have a one dose regimen. Now, the question that I've gotten from almost everyone, it's a really good question. It is, if I got a vaccine that has 94, 95% efficacy, Pfizer, Moderna, and I got this one over here that's 66%, why would I take this one? Why in the world would I take a vaccine that has a lower efficacy, doesn't work as well, even if it's easier, even if it's one shot? So here's the bottom line. The top line number, what you really have to ask yourself is, well, what is it preventing? And if you dig into those numbers and look at how the vaccines are actually causing people to avoid sickness, they actually stack up pretty well. They're all pretty good. And what I'm talking about specifically is severe COVID-19. So people going to the hospital with COVID-19, people dying of COVID-19. I don't know about you, but that's what I really care about. If we could turn a virus from a potential killer to a nuisance, or, just something that you get and, you get over it, I'd be cool with that, because we can get our kids back in school with that. We can open up the, businesses and kind of get back to normal. It will be just as good. Now, if you look down at that data for Johnson and Johnson, I spent like 2 hours looking at this, 50 whatever page document, and you actually look at how did people do as far as staying out of the hospital. No one died from COVID-19. After the vaccine had enough time to take effect, there were no people who went to the hospital with COVID-19, zero people who died of COVID-19. So that's a game changer for me. And if that was available to me, that's the one I would get. If I had a choice between the three and one was available, that's the one I'm going to get. So personally, for me or my family, the answer for me and for them is going to be whatever one they have available. That's the one you get, because as far as keeping you from getting sick from COVID-19, going to the hospital, dying from COVID-19, they are all near 100% effective. So that top line number could be a little misleading.
Thank you for that, because that was actually a question that I know I had, especially considering that 2-dose versus 1-dose. We do have a question in the chat. I want to make sure we're getting our chat questions in. And the question is, can the spike protein cause problems in some people?
Yeah, good question, because the spike protein is something that the coronavirus uses to gain access to your cells, but it's not something that is supposed to be present in our bodies. And that's the whole point. Your immune system is really designed to recognize things that aren't supposed to be there. So it's like Miss Jenkins, who lived in my neighborhood and did a neighborhood watch. If someone came around that wasn't supposed to be there, she was going to let you know about it. Your immune system is just like that. If it sees something that's not supposed to be there, it lets everyone know, and then you can make a response to it. Now, the question, can the spike protein by itself cause any issues? And the answer to that is no. So by itself, it's just a little protein. It's not attached to anything else. It doesn't cause any problems. What it does do, and this is a good thing, is that when your immune system makes that response to it, it can cause you to feel a little bad for a couple of days, because your immune system's working hard to generate that response. It takes energy to do that, and that can kind of make you feel bad for a couple of days. But as far as causing any sort of long-term damage, causing, and things that I've heard, let's just put it out there, infertility, inability to have getting to your genetic material, it doesn't do any of that. It actually degrades pretty quickly too after it's kind of done this job and been presented. So there's no concern that the actual spike protein will cause any problem.
Thank you for that. Someone else asked a question about COVID, and let's address this one too before we talk more about the vaccine. Someone asked, how quickly can you catch COVID after? Cynthia, do you have another part of that question? I'm assuming that you mean after getting the vaccine, or?
If you've had COVID once, how quick can you catch it again? Can you contract it again?
Okay.
I see.
Clarifying, Cynthia.
Yeah. So unfortunately, we have seen cases where people have been reinfected with the coronavirus and had COVID-19 again. Now, it's very unusual to see it within 90 days of getting that first infection. So within 3 months, we haven't really seen that be the case. And for most people, even after that 3-month period, they're going to have a good immune response and have good protection. But some people may not have had a large immune response the first time, and it may have gone down a little bit, and they can get reinfected. So in my hospital, after 3 months, if someone comes back in with symptoms that can be consistent with COVID, then we consider them potential reinfection.
I want to piggyback off of Cynthia's question. Earlier, you mentioned that even if someone does get the vaccine, they can still become infected with the virus. Is their response, have you seen that their response is different based on whether they've had the vaccine or not? Do we expect them to have a weakened response or just minimal symptoms or side effects if they were to have the vaccine and then contract the virus versus if not having the vaccine?
Yeah, great question. So 2 things I should say. So first, it does take time for your immune system to build up that response. So it's not like if you get the coronavirus vaccine on day one, that you are protected starting at day 2 or so. It takes about 14 days or so for you to ultimately get that response. And so for Pfizer and Moderna, you get somewhere between 50 to 80% protection 14 days after you get that first dose. And then after you get that second dose, it takes another week to get that full 94 to 95%. And for the Johnson & Johnson vaccine, it was 14 days or so after getting that one. It's a one dose, remember, one dose shot. 14 days after is when you got that protection. So you would not consider yourself protected until you've had that time period to build up that immune response. Now afterwards, it's not 100%. There's only one thing that's 100%, and that's the man upstairs. So nothing's ever going to come close to that, right? But the vaccines do work pretty well against protecting from severe COVID-19 or symptomatic COVID-19. So what that means is that it's still possible, and some people did get COVID-19. It was way less than people who did not get the vaccine. But what we saw was that in terms of people getting really sick from COVID-19 who got reinfected or got infected the first time, they tended to do fairly well. So people going to the hospital after they've been vaccinated, extremely rare. People die from COVID-19 after getting a vaccination. I don't think it's happened actually between these 3 trials. I don't think anyone who's been vaccinated has actually died of COVID-19, which is a real game changer. So that's the benefit that you're looking at by getting the vaccine.
Thank you. And while we're talking about people who have tested positive for COVID, and then in reference to the vaccine, we have another question in the chat that I'd like to go ahead and get your thoughts on. Too, it's a great question. If you have had COVID and are still within your 90 days with positive antibodies, do you suggest waiting for a little while for vaccination, or go ahead and get it within those 90 days?
That's a really good question, because I had to think about this with my own mom and dad. So my mom works at Target, my dad drives a bus, and bless their hearts, they've been worried about me the whole time, and I've been worried about them the whole time because they're actually going out into the community. I get to wear full PPE. They don't get to do that. So they actually caught COVID-19 about 3 months ago, actually. And both did well. Luckily, my mom actually, she had symptoms and called me and told me, I have COVID-19. I'm going to go to the doctor and get tested. And it turns out she had it, because my mom's like that. But anyway, they both recovered. So this question came up: if you've had COVID-19, should you get the vaccine, and should you wait on any sort of time frame? Now that's changed a little bit, because initially when there was extremely low supply of vaccine, I'm not saying it's good right now, it's still not good, but initially when it was just a tiny bit of vaccine, we were telling people, if you've had COVID-19 before, to wait until you've gone close to that 90-day period before you consider getting vaccinated, but to go ahead and get vaccinated. That has changed a little bit to say that you can go ahead and get vaccinated. We just want you to wait until you're not sick anymore. So with any vaccine, you want to take it when you're healthy, because you want your immune system to be in tip-top shape. You don't want to deal in with any other illness, whether it's a regular cold, the flu, or being sick from anything. You want to be completely healthy. And so the recommendation is to wait until around 2 weeks after you've had COVID-19. You want to make sure that you're feeling better. But I think based on knowing that you can have that immune system decline a little bit after 90 days, I want to start that vaccination series before that. So I had my mom and dad start so that they would finish before that 90-day period ended for them.
Thank you. I want to kind of switch gears just a little bit and talk about the actual vaccination process and kind of what people can expect once they get the vaccine. Can you talk about some of the common side effects that people have experienced, complained about, and what would you say to people who are worried about what they might experience once they get the vaccine?
All right, so a good question as well, because we always want to know the side effects. So with that first vaccine dose that I got, and this I got the Pfizer vaccine, but the Moderna was very similar experience with my colleagues. I had some arm pain. That first, it was very similar to when I get the flu shot every year. Just a little bit of arm soreness that you kind of work it out a little bit. It lasted about a day or so, and that was it for the first dose. Now for that second dose, I had seen in the trials that people tended to have a little bit more symptoms with the second dose than they did with the first dose. So symptoms like maybe having some chills, some fatigue, some muscle aches, fevers, even some low-grade fevers, temperatures. those were more common with that second dose. And so I was kind of preparing myself for that second dose. And I took it, had that same arm pain. And then later that evening, I had some chills, didn't have a fever, but I just felt cold, couldn't quite get comfortable. I put on a sweatshirt and had an extra blanket. My wife said I was holding her tight the whole night. So I was annoying her. But then by the morning, I just kind of felt generally a little kind of off. But then by that next morning at noon, I felt completely back to normal. So my symptoms lasted about 36 hours or so. And what I've seen from my friends and colleagues is that, some do have, some of those sorts of symptoms with their first dose, but most of the time it's just arm pain. And then with that second dose, you might feel a little bit bad the first couple of days. That's that immune system kicking in and working and doing what it's supposed to do. I will say that I think men and women experience probably the symptoms around the same, but I've noticed that the women just complain less about it. So, just putting that out there, just as what it is.
I can get with that. I can get with that statistic. So essentially, when you're feeling some of these symptoms, it's really kind of a clue that your body is kind of doing what it's supposed to do in response to receiving the vaccine. Would you say that was somewhat accurate?
That's true. That's very true. So when I had those symptoms, I wasn't concerned. I wasn't worried. If I felt like I needed to take an Advil or Tylenol, I would have taken it, but it never crossed that line. But that is the sign that your immune system is doing what it's supposed to do.
Is there anything anybody can do ahead of time to minimize the symptoms, or is it kind of just luck of the draw, so to speak?
Yeah. So I had one friend who, after that first dose, had some fevers and chills, and it lasted about a day or two. But after that first dose, and she asked me, "What should I do about that second dose?" And I said, for you, just go ahead and take an Advil or Tylenol before that evening comes, so that you can kind of head that off a little bit. And she did that. The CDC recommends against doing it routinely, meaning you shouldn't just do it if you don't expect to have any of those symptoms. But I would say if you had some of those symptoms with the first one, we think the second one might be worse. That I think that's fine. There's nothing that, despite that recommendation, I don't think that there's a pain medicine that you could take that would affect the responsiveness of the vaccine. We just can't say that scientifically because we haven't studied it carefully in a trial.
Okay. Now that we have the Johnson & Johnson, it's a 1 dose, people are still, as they're registering to get the vaccine, are right now being registered to receive either the Moderna or the Pfizer, which are 2 doses. And I think, and you can correct me if I'm wrong, I do think that the timeline is about 21 to 28 days from the first dose of this, when they want you to have the second dose. One of the problems that we've run to here that my parents actually ran into was their second dose of that vaccine got rescheduled or got actually canceled, and I had to help them reschedule it just because of lack of vaccine availability. So there was a concern about, well, how long do I really have between that first dose and that second dose? So is there any flexibility if people are scheduled for the Moderna or the Pfizer vaccine? Is there any flexibility in how long they can wait from first dose to second dose if they are having problems scheduling that second dose?
Right. I'm sorry to hear that. So
they got it today. They're good now.
Yeah. So I believe the CDC says up to 42 days or 40 days, somewhere around that period would be fine to have that delay. I think from a pure scientific standpoint, that sort of dosing regimen has not been studied. So you can't say with 100% certainty that it's going to be fine. But I will say, because I'll just be real with you all, I'll tell you what I think. We know that from previous sorts of vaccine schedules where you have booster shots, so tetanus would be one instance of that, MMR can be another one, that even if there is a delay, that it's not like your immune system completely forgets that first dose, that you can still get a benefit from getting that booster shot. But the CDC can't say that if it hasn't been studied. But I think, my mom actually had her second dose delayed by about 2 weeks or so. I wasn't worried about that at all. I think that would be completely fine. And I even think a few weeks after that would probably be fine as well.
I see we have a couple more questions in the chat. And for those of you who are just joining us, thank you so much for joining our discussion tonight. And as we're talking, if you have questions that we haven't answered yet or that are really burning, please go ahead and put them in the chat. And I'm going to keep monitoring the chat to make sure that we get to those. Our next question, Dr. Bell, is someone's mom had an extreme case of COVID. She went for her first vaccine last week, and the day after the first dose, she had low-grade fever, muscle aches, and a headache. Do you think that she will have worse symptoms for the second dose?
right? So always hard to predict, but the trend that we've seen is that people do have a little bit more symptoms with that second dose. So of course, I'm not giving specific medical advice, but if someone had this sort of scenario, I would suggest taking something to kind of try to head that off a little bit before after they take that vaccine.
Okay. And then another question, there is speculation of variable blood type influence upon COVID-19. Does any blood type bear upon the efficacy of any of the vaccination models? So does blood type make a difference as far as efficacy of any of the vaccines?
Yeah, so this was a question I had about 6 months ago or so, because I saw that data showing that there was a blood type that could do worse with COVID-19, and it happened to be my blood type. It was A positive. But from the way I thought about a question like this is there something that is in that sort of data that would make me do something different about how I live my life? So if I had a blood type that wasn't, that blood type, would I not wear a mask? Would I not physically distance? Would I still, do things to try to prevent the spread of COVID-19? And the answer was, it doesn't matter what that blood type is. I'm going to still do the same thing. Now, I haven't seen any data to suggest that there's a blood type that does better or worse with the vaccine. But what I will say is that, our blood types are, they're very diverse within the population. And so within those 70,000 people in the Pfizer Moderna and the 40,000, I believe, in the Johnson & Johnson vaccine, there were all those blood types represented. I'm sure yours was in there as well, too. And the vaccine just worked extremely well across all those types. I don't think they look specifically at blood types, but we can be assured that it works for the vast majority of people just fine. So I wouldn't be concerned about blood types affecting the efficacy of the vaccine, because they do just work so well.
Thank you for that. Another question that I have, recently, I'm sure a lot of people on this call probably as well have been hearing about the new variants of COVID-19. Can you speak to that, and will these vaccines provide any protection against these new variants that we're starting to see within the U.S.?
Yeah, really good question, because that's been like the next sort of concern about this. So the variants are, and just to backtrack, so variants are just changes in the virus that happen as it goes along over time. Because like I said earlier, there's only one thing perfect in life, and that's the man upstairs. Viruses are imperfect. So that means when they replicate and kind of reproduce themselves, they might make some errors in those copying and when it's copying itself. And sometimes those copies don't really mean anything different for the virus, but sometimes it gets lucky, and the change that it makes or an error that it makes it easier to spread to someone else, or makes it more lethal to someone else. Now, these variants that have been circulating, and they're named after countries. So there's South Africa, there's UK variant, there's concern that there might be a New York variant. All it means is that's where they were discovered. But the common theme is that they're more easily spread between people, and that's why we can see more higher spike in cases. And so when we've looked at how the vaccines have responded to these variants, what we've seen is that in some instances that level of the effectiveness may come down, but it doesn't fall below that threshold that we would call it ineffective. So we haven't seen anything that we would say is that the vaccine would not work against, but we can see that there's a potential that it could happen in the future. Now that said, there's nothing to suggest that the Johnson & Johnson vaccine, the Pfizer Moderna vaccine would not work at the variants that we have now, but there is that possibility that might happen in the future with a new variant. In fact, the Johnson & Johnson was tested in South Africa. That's the variant that everyone's been so worried about, that kind of brought those levels down. 95% of those cases, so 95 out of every 100, were that South Africa variant in the people in South Africa, but it still kept people out of the hospital, still kept people from dying from COVID-19. So still very effective. Now, the reason why that the immune system in the vaccine might work against this is I like analogies. So when I was a kid walking home from school, there were some dogs in my neighborhood that would come out and chase me. And I knew who those dogs were. I could tell you the street numbers where the dogs were, but I knew that I had to jump on a car or do what I had to do to kind of get away from it. Now, there was one day I was walking home, I was walking the same route, but there was a different dog I hadn't seen before, but it gave me that look that I knew I needed to hightail it and get it out of there and do what I need to do to keep myself safe. Now, I hadn't seen that dog before, but it had a tail, it had a snout, it had the eyes, it had the look. I knew exactly what was up and what I had to do. So your immune system works the same way. It uses different parts of the spike protein or whatever it's looking at in order to tell if this is a friend or an enemy. So even if there's one part of that spike protein that changes with a variant, your immune system is looking at many different parts of it at one time. So even though one part might be different, it's still going to be able to tell in most instances that this is not something that's supposed to be here. We got to get it to go, and you'll still get that immune response. Now, with that said, there is that possibility that something might change so much over time that your immune system may not be able to respond to it, and we haven't seen it so far. But just in case, these companies are actually looking at updating their vaccines to make sure that they can account for those. So if there was some instance where the vaccine would be a little bit less effective, we can just get a booster update shot. We're not sure if that's going to have to be the case, but we want to be prepared in case we have to.
That was actually my next question. So thank you. Thank you for reading my mind there. We do have some questions popping up in the chat that I want to get to. And actually we have two from the same person that I think are kind of related. So I'm going to go ahead and do those together. The question is, what is suggested for those who may not want to get the shot? And can a natural regimen of vitamins keep you safe from getting sick, especially something like vitamin D3?
Yeah, so really good question, because I take a supplement every day and I take vitamin D, and I think those are really good things. So having a balanced, healthy diet, exercising when you can, not smoking, all of those things are good things to do. So in general, people who are very healthy who have COVID-19 tend to do a little bit better than those who have these chronic conditions. But what I'll also say is that as an intensive care doctor, I've seen plenty of people who were young who had severe COVID-19. And even if they did not have severe COVID-19, there's a lot of young folks who have had these sort of persistent symptoms. So long COVID, which can affect a quarter or even a third of people who, even after they've recovered from the infectious part of the illness, they still have these persistent symptoms. And my mom actually had a little bit of the change in her smell and taste persisted for a few weeks, several weeks after she had COVID-19, and it got better, but it took a longer time than anyone wanted it to be. So that's still a possibility, and the vaccine is really what's protecting us against both the severe illness from COVID-19, but also potentially having these other severe symptoms. So the thing that I would say to someone who is healthy, doing supplements, doing what they're supposed to do to keep their body healthy, I think this is that next step towards protecting your health against something that's caused so much problems in so many people across the nation, including healthy people. I think it's got kind of another weapon that we need to arm ourselves against. And the other argument is, even if you are healthy and people around you are healthy, there's that possibility that, a family member or a friend or a loved one, you could potentially get sick and you do fine, but you pass it on to someone else. And I don't know about you, Dr. Davis or Dana, but I was really worried about passing COVID-19 to my family, even if I was doing okay, that my kid might get it, my wife might get it, and they might get sick. And my mother-in-law comes and watches our children, and she's older in age, and we were all worried about this. And myself getting vaccinated, we do have data now suggesting that if you have the vaccine, you're less likely to transmit it to others. That's just peace of mind for myself, and I want that for everyone to have that peace of mind.
Thank you. We do have another question in the chat. It says, I have neuropathy and it seems to affect the outcome. Is there anything that you can address related to someone having neuropathy or any other medical conditions that they should be aware of regarding contracting COVID-19 or risk with the vaccine, or the benefit of the vaccine on the other end of the spectrum for people who do have comorbidities or medical conditions?
Yeah, so I'll first say I haven't seen anything that suggests that having neuropathy itself changes your outcome with getting the vaccine. What we do know is that neuropathy can be associated with diabetes and other sort of medical problems and comorbidities. So it probably suggests that that someone could have more severe outcomes from COVID-19. We have not seen any evidence so far that anyone with neurological diseases like neuropathies have any sort of increased risk of side effects from the vaccine or decreased effectiveness of the vaccine.
Okay. And another question in the chat, in relation to the notion or theory of herd immunity, what percentage of the population needs to get vaccinated in order to achieve herd immunity?
I wish I knew that exact number, because then, I wouldn't have to work anymore. So herd immunity, that concept is, I don't know if you guys were like me, but I watched those National Geographic specials where there was like the wildebeest in Africa, and there was a pack of lions trying to come after one of them, and they would always go after the young and the older. Because they were easier to take down. So what would the wildebeest do? They would crowd around in a circle, put their horns out, so the lions aren't able to get through and get to those weaker individuals. So the herd is actually protecting the weaker individuals. So it's that same concept, right? So if enough people are protected against COVID-19 with the vaccine, or if they've had natural immunity, even those few people who may not have had the vaccine or may not have been exposed and been sick yet, even though they're not protected, in a sense they are, because so many people around them are protected. The COVID-19 or the SARS or the coronavirus is not going to be able to get through and cause them to be infected. So our best estimates at this point is that it's somewhere between 75 to 85%. I wish I had a better number than that. But that's kind of that range where we think that we're going to have to have before we can say that we have that protection, so that there'll be that rare individual who may have a medical reason why they can't get the vaccine or may just not choose to get the vaccine. But if enough people around them are protected and vaccinated, then they'll have that protection. So my argument for people who are able to get the vaccine and choose not to, make sure that you're well informed and you have the information that you need to make that decision. You don't want to make that decision based on either false information or misunderstanding about how things work. You want to make sure that it's accurate information. But I don't want my health to depend on what someone else is doing. I want to be protecting myself, protecting my own house. So that would be my advice there.
Thank you. And I have a kind of a piggyback question along the same lines. One of the questions that we got ahead of time was, when can the church open again safely? Dr. Bell, I'm going to start with you. And then once you're done, I actually like to bring Dr. Davis back in as a member of One Church. But what is your stance on when churches realistically can and should open again, when we can get back together as friends, family, as a congregation to safely worship together again?
That's a good question, because I have wanted to have that church family back and to hug everyone. And I really can't wait for that moment. I think it's going to be extra special. So I don't know how it works in South Carolina, but in Virginia, there's actually an exception for churches. They could stay open throughout the whole pandemic, but my church has actually gone virtual this year. I think it depends on the actual setup of the church. So some churches are in tightly packed buildings, not good ventilation, crowded with lots of people, and I don't think that's a good sort of scenario for folks to be congregating. So I think, like my grandmother taught me, the spirit of the Lord is not the bricks and mortar, but it's the human souls, and we can still connect and be with each other and still have church, even on Zoom. I feel like this is a form of church for me, actually. I think if that's the setup, then that may not be the safest thing to do. But there are other churches that are larger spaces. They have a virtual component and an in-person component. So some people are coming and some people are staying at home. Sometimes they're rotating that. And then some churches that have better weather are actually holding services outside. And I think that's actually very safe to do. We want to make sure that we're still doing physical distancing. So not social distancing, because we're socially still bonding with each other, but 6 feet of space. We want to be wearing masks, and we want to be washing hands frequently and things like that. But if I was a betting person, I'm not. But I have a lot of hope that by the late fall and early winter, we will get to that mark that we need to, and we can actually get back to the way things or close to the way things were.
Tyson, Dr. Bell, I feel like you read my mind there too. I will add to that in that I think looking at our church and our physical building, I think Dr. Bell hit on it in that our church we don't have a huge sanctuary, and knowing that our church isn't we have a limited amount of space. We have to be careful in how many people we let back into the building. And the good signs is that Dana kind of read on these statistics early on. I definitely like the trend that we're seeing nationally, or seeing that COVID cases are down, incidence rates are down. I think it's going to be very, very important that we continue to encourage not just our members, but our communities who we interact to make sure that we're getting vaccinated. So it goes back to that, when would I feel comfortable knowing that the people around me are also protected, that they're also providing some of that community immunity, so that I am not, or my family or the people who are not vaccinated are being protected. And so it is going to be important that, one, we still encourage people to get vaccinated, especially within our church community and their interactions or their unit. And then, but also making sure that we're encouraging the community to get vaccinated. One of the things that I want to make sure that we add on that, or just hit, is that 14% that Dana hit on early on about who's being vaccinated within our community, knowing that there's only 14% of the Black or brown population that's being vaccinated, and finding out, or actually seeing whether or not, Dr. Bell, you can hit on this, and seeing what's the apprehension behind a lot of our community members or our community in getting vaccinated.
I think so a few things. So, one, there definitely is hesitancy. And maybe hesitancy is not the right word, because I think people should have tough questions about something that you're going to put into your body, right? So let's just put that out there. But Dr. Davis, the medical establishment has earned the mistrust of Black people. So, I think when folks say, oh, there's mistrust in the Black community, what I tell my residents and students, that's an earned mistrust. Like, medicine has worked hard to get on the bad side of Black people for decades, for generations, and going back to grave robbing in the early slave days to teach medical students, the eugenics movement that was in my state, Henrietta Lacks, Tuskegee. We could just go on and on. We can take it all the way up to Susan Moore, who died of COVID-19 in Indiana, right? We see these stories. So we have to address that and be just open and honest and say, we don't have a good track record when it comes to this. Now, that said, what I will say about this moment in time is that what we see here is a crisis of both communication and access. And what I mean by that is people don't have a great understanding of what's in these vaccines, how they work, what the safety and efficacy is, and all these sorts of things. That's why we're doing forums like this, because we haven't had that message coming from the top, from trusted people. We need to do a better job of leveraging and talking with community leaders, like like churches and the clergy and faith-based organizations, community organizations, to use them to get that message out as well. So that's in the past. So what we have now is a pandemic that's causing a disproportionate share of the loss of Black life, and that just hurts my heart, because that's my community, and that's why I went into medicine. Why Jeremy and I both went into medicine to really combat this. But the way out of this is this vaccine to really break the back of the pandemic. And so when we're looking at these issues of mistrust, we have to meet the community where they are, be honest about what's happened, talk about what we know and what we don't know about the vaccine, and really give people the information that they need. Now, the other part of that is access, right? And I don't think you can talk about one without talking about the other. So many of us go to the grocery store, for example. We could all probably agree that we want to save money when we go to the grocery store. Now, how many of us will spend 2 or 3 hours searching through the internet or going through the newspaper to actually clip out all of those coupons? Some of us do. My grandmother certainly did, but a lot of us don't. But if we have the coupon when we walk into the store, there's a booklet, or the cashier gives us the coupon, we're going to use it. So part of that decision making depends on our access. So you could say to a community that has some hesitancy, well, you don't want the vaccine, so let's not work hard to get it into that community. All right, and that's one tack that you could take. That's the wrong tact, obviously. But if you provide that vaccine to that community, most people are going to be on the fence, but maybe leaning towards getting the vaccine or leaning against getting the vaccine. That's where most people are going to be right now. I don't think there are many people that are like, yay, sign me up, put me in the front of the line. That was me, but that's not most people. But if you have a community center, a church, a faith-based organization that has a vaccine set up with trusted advisors, and you see people in your community that you trust, that you know, and they're getting vaccinated, then that makes it a little bit more acceptable for you to get vaccinated. So I think this notion of separating the hesitancy from the access, they really need to be linked together. And what we need to do is make sure we have focus events that gets vaccine to the community. I think we should reserve vaccine doses for high-risk communities like Black and brown communities, get them in there, pair that with a communication effort, social services if we need them, and education to make sure that we're getting people both the information that they need and the access to make that decision right there in that moment to get vaccinated.
Dr. Bell, we have a few more questions in the chat. Someone said yesterday or this week, it was stated that the vaccination will become a yearly shot. Is this the case? Have you heard that? Oh, you're still muted.
Sorry, you think I should know how to use Zoom by now. I'm not sure at this point if it's going to have to be a yearly vaccination. It depends on a couple of things. So one is how long does that immunity tend to last? I do think it's going to last, several months, but will it last for several years? I'm not sure at this point. So that's one. And then two, we still have this situation with the variants where now we don't have evidence that there's a variant that the vaccine won't work against, but there's that possibility down the road. So, could it become like the flu shot and we take it every year? Or if it's like one of the others where it can kind of last and, for a much longer time. I'm just not sure at this point. I wish I had a better answer.
One other question that kind of ties into what we were just talking about with the access and the hesitancy and the mistrust within the community. The question is, can you speak to the confidence we can have in taking the vaccine as it relates to the speed of its creation? Normally, it takes several years for a vaccine to become available. However, this vaccine was produced very quickly. Is it in part because of the medical community's familiarity with other coronavirus types that existed previously?
That's a good question. Pastor Buford, Lady Buford, you all read up. So this is a really good question. I'm glad it got asked because we need to talk about this. So before the coronavirus vaccines, the quickest vaccine that was developed was the Mumps vaccine, and that took 4 years, I believe, to get developed in the 1960s. And so the natural question is, all right, it normally takes 10 to 15. Before this, the record was 4 years. So how did you do this? And is this actually safe? The answer is $18 billion with a B is what allowed this to happen. Now that's the quick answer, but just to backtrack and go back to the beginning, if you wanted to bring a vaccine from creation all the way to the market and into people's arms, there are 3 main steps that you have to get through. So the first step, you have to actually make it and demonstrate that it's safe. You have to study it in a large population to make sure that it works and that it's also safe. And then 3, you have to actually make it, manufacture it, distribute it, and get it into people's arms. So going back at those 3 steps, the messenger RNA technology in particular was not something that somebody made up, just a year ago. It's actually been worked on for over a decade. And so science has gone into this for many, many years, and actually there were messenger RNA vaccine trials for Zika and Ebola. The market just never took off because they kind of became less of a public health crisis. But the technology had existed, but it just needed to get over that line. So it's just like if you're watching football, the messenger RNA technology was down at the goal line, and we just needed a push to get it over there to get something to market. So it wasn't completely made up. So that timeline wasn't as long as it seemed. And now with the clinical trials, that infusion of money and the world's attention focus on COVID-19 is what really allowed scientists to set up the trials in rapid succession to make sure that we could enroll a lot of patients. We coordinated between sites, and so we combined sometimes a phase 1 and phase 2, or a phase 2 and phase 3. And those are just different sorts of numbers of people that you want to test. So phase 1, you're just making sure that it's safe and you want to figure out the dose. Phase 2, you want to start looking at how well it works in addition to keeping it safe. Then phase 3, you really look at a large chunk of the population to make sure that it works in many different kinds of people.
Sorry, here, watch your butt.
So for those 3 phases, we were able to save time with them. And then because, unfortunately, fortunately, because the pandemic was raging at this time, those endpoints where you can actually determine if the vaccine works because enough people have gotten infected, you can see a difference. We made those sooner because the virus was just causing so many infections. So that timeline was able to be compressed. And then third, the manufacturing part actually happened during the clinical trials, which a company normally wouldn't do, but the government actually contracted with Pfizer and Moderna to start making vaccine doses under the assumption that it would be safe, but not guaranteed. But once it was proven that it was safe and effective with the phase 3, there were millions of doses already ready to go. So literally it was approved on a Friday, and I got the Pfizer dose on that Tuesday, which you would normally never see. So most importantly, what I did not describe was shortening or cutting corners with the actual science that went behind it, how the clinical trials were done. They were all done sound and ethically. There were Black scientists that were involved in both the creation and the study and the approval process. HBCUs were involved in this. And so it's a very different story than before, because we have confidence that people like Dr. Kizzy Corbett at the NIH, who was behind the Moderna vaccine technology, and not HBCU, she went to UMBC. And studied at the NIH, and Dr. James Hilbreth, who's at Meharry, the president and CEO, who's on the approval committee. His committee actually approved the Johnson & Johnson vaccine. They don't cut corners. They don't play games. They're looking out for our community, and I trust them when it comes to how they advocate for their science. And so it's very different. Even though we were able to compress that timeline, it was a combination of already being sort of there or halfway there, more than halfway there, having $18 billion to pour into it, and then having some high quality Black scientists who were pushing the charge and making sure that this was safe for us.
Dr. Bell, I just have one last question before we kind of wrap up and see if anyone else has any more questions. Is there anyone who should not get the vaccine?
Yeah, good question. So as it stands now, the only people who the CDC suggests should not get the vaccine are those who have reacted to an ingredient in the COVID-19 vaccines, or if they've had a severe reaction to a prior dose. So I've had one friend who had a severe reaction. It wasn't anaphylaxis, that the immediate life-threatening injury that can happen sometimes, but their doctor said, this probably shouldn't be something that you take the second time. What we've seen in the trials, or really with the rollout that happened after the trials, it's around 1 in every 200,000 people will actually have one of these severe reactions that will qualify them to not get that second dose. So if you think about, in my state, and this is funny, I usually call my state the South, but not in front of South Carolinians. But in Virginia, the capital is Richmond, Virginia. It has about 200,000 people. So the example I give is if you vaccinate all of Richmond, there'll be one person who gets that severe reaction. But over the course of the year, because of how we know how many people die from COVID-19, 200 people will be alive that would have died because they got vaccinated. So when you look at that risk benefit, you see that, it weighs towards getting the vaccination. But if you have those concerns, for sure, speak with your physician just to make sure that you can make the right choice.
Thank you so much. I want to make sure that we do have time for anyone who is joining by phone to ask any questions. We have a couple people, I think, that are on their phone and not able to chat. So if you do have questions, I'll give you a couple seconds to come off mute if you do. I think Dr. Bell, Dr. Davis, Dr. Bell did a fantastic job of providing us with a lot of good information tonight. So hopefully we were able to answer your questions. The website on our church website that you all went to get to the Zoom tonight does still have that question box. So we can leave that up. And if after tonight, if anyone thinks of anything, you can just go back to that webpage, go to that box and submit questions, and we will get those answered right back and emailed to you. Before we wrap up, a couple things. If you are in South Carolina and have questions about how to even get the vaccine, if you go to our Department of Health's website, it's scdhec.gov. So southcarolinadhec.gov, scdhec.gov. There is a link at the top of the page that says, find your vaccine location. You click on that, you put in your zip code, and it will give you a list of 75 nearest vaccine locations. And that includes Walgreens, Walmart, Ingalls, Prisma Health, St. Francis, and you can kind of go from there to find a vaccine location that might be right for you. And then once you go to that location, it'll have information about how to actually register for the vaccine. That same website, the DHEC website, will also tell you who is currently eligible to receive the vaccine. And then when you go to register, there will be information about the eligibility criteria and whether or not you meet that. If you are out of state joining us, I'm sure that your Department of Health's information, and thank you to Derek Farthing for putting the New Jersey vaccine information. Thank you so much for doing that. If you go to your Department of Health's website, you can find out about how to get vaccinated. As we wrap up, I want to leave time for just some final thoughts. Pastor Bufford, would you like to come off mute quickly and say some things, and then we'll have Dr. Davis and Dr. Bell kind of wrap it up for us with any final thoughts they have.
Sure. Awesome. Can everyone that's attending this do me a favor and use your emojis, and let's just give Doctors Jeremy and Dana Davis a hand for putting together a stellar event. I'm telling y'all to do something, so let me do it myself. There go my clap hands emoji. All that good stuff. They're awesome. And I thank God for them. One Church, as I told them previously, privately, and I tell them publicly, we're all the better because of them. And so we're grateful to have them a part of our congregation. And One Church, thank you for logging on tonight. And then our other guests, family, and friends, thank you for joining us as well. To Dr. Bell, Lady Bufford has already said you can prepare yourself for a invitation for Clemson University's Diversity in Science Seminar Series. Jeremy, she said she will let you retain the fall, and she will get him for the spring to help balance it out, or maybe do a panel discussion. So you can chat offline to tell him what he can prepare for in regards to that. She's like, oh yeah, we got to get him for diversity in science. So you're on the side. So
I'm here for it.
So thank you all. And I just wanted to just give Dana and Jeremy an awesome thank you. We love y'all. Thank you so very much. Dr. Bell, thank you, sir, for availing yourself and your time and sharing. And it's so refreshing and wonderful. And I'll hand it back over to Doctors Jeremy and Dana Davis.
Dr. Davis, or Dr. Bell, let's start with you. Dr. Bell, any final thoughts for everyone?
Yeah, so I just want to leave a parting comment, because one thing that I give a lot of talks, and one thing that we always do at the beginning of the talk is just talk about what are any conflicts of interest that are out there that's influencing why I talk to you. And I want to be cognizant that it sounds like I'm a salesman just trying to push this. And, I haven't said anything bad about anything about getting the vaccine, but I want to just make it clear that I'm not on the payroll for Pfizer or Moderna or Johnson & Johnson. I don't even like drug companies. The reason I'm here and talking to you all is a combination of two factors. So the first is that the vaccines actually do work pretty well. They work much better than I thought they would, and many of us would. They're very safe and they're very effective. And two, what's really motivating me is that I am sick and tired of seeing people who look like me get sick from this and die from this. And we've done it. It's happened too much now, and it's just the reasons are many, and that's a whole other webinar series. But fundamentally, in my heart of hearts, I'm looking out for my community, and that's what's motivating me to come up and speak with you all and give you the information that you need to make a good decision. So, that's why we're here, and that's my conflict of interest, that I love my community.
Dr. Davis, any final thoughts for us before we wrap up?
Definitely appreciate you spending the time with us, Dr. Bell. I think your insight has been valuable, very, very valuable, informative for all of us. I do want to leave with this. We've been dealing with COVID for over a year now, and I do look forward to the time where, as a church community, as one nation again, that we're able to get together and we can spend some time. And I think it's going to take a concerted effort from all of us to get to that point. So make sure that you're continuing to promote the right information. Again, we're not strong arming you and trying to get a vaccine, but we do want you to have the right information, the right resources to pass it along, to make the informed decision for yourself. One of the things that we want to make sure is access. Dr. Bell hit on access, and access is still going to be important. We're having a conversation about the COVID-19 vaccine right now through Zoom, which means that you have to have a computer, you have to have internet, you had to have a phone to be able to tune in. And not everybody in our community has that. And so it's going to be important that you are stewards of this information, that you pass it along to community members, to family members that couldn't make it, that are around, that don't have access to this. It's also important for us to do that as well. But I just hope that, and I pray that here soon that we continue along and that we continue to work hard, continue to mask, continue to wash your hands, continue to social distance, physical distance when we can. And then hopefully one day soon, we're all together, we're all still alive, we all can join together and we can worship together. So that's what I'll leave my parting thoughts.
Thank you all so much for joining us tonight. I know Pastor and Lady and First Lady have put some information in the chat about how to access the DHEC website, and also for Easley residents, the city is in the final stages of making the J.B. Red Owens Rec Center a vaccination site, which is wonderful for access. Thank you so much to Pastor and Lady B for giving us this platform to do this. Thank you so much to Dr. Bell for taking time out of your schedule to share your expertise with us. Thank you to Dr. Davis. Thank you to all of you. Again, questions can be put on the website and we will get back to you as best as we can with the best information we can give to you. You all have a wonderful, blessed, and safe evening and weekend, and we look forward to seeing you and one day hugging you and holding you and worshiping with you again. Thank you all so much.